So this healthy patient model is something that I've been working on for the past decade since we opened the hospital. And basically what it is if you're gonna have your hip or knee replaced, you're not sick. If you're sick, we've tuned you up, we've gotten you in good shape. This isn't like an emergency, it's a planned surgery. So we're not gonna pretend that you're sick. We're not gonna try and keep you in the hospital for days on end and then send you to a nursing home. Our focus is get you up and get you moving, minimize your interaction with the hospital, get you home, don't keep you housebound. It's okay to go out, start outpatient therapy sooner. In doing this, actually, there's less complications. There's less infections, there's less blood clots because people are getting up and moving right away. So if you're healthy and you're having an elective surgery, you don't want to hang out in the hospital any longer than you need to. That's why we do the healthy patient model. So, how do we achieve that? Well, there's a lot of things that go into it. We have a very strong emphasis on preoperative education for our patients. We have classes every week for patients having hip and knee replacement to learn what to expect before, during, and after the surgery. If patients would benefit from preoperative physical therapy, we have those programs set up. We have rapid mobilization. We get patients up the same day of surgery to get you moving right away. We try to minimize the hospital stay. And we try to start the outpatient therapy sooner instead of keeping patients housebound after surgery. If you're mobile enough, we'll get you in outpatient therapy anywhere from 3 to 10 days after surgery. Depending on how you do these surgeries, there can be a lot of pain afterwards. Multimodal pain control is something that I've been doing for many years, and this works really well. The theory behind this is that you know you're gonna have a surgery and it's gonna hurt, so I will treat your pain before it starts. And I'm not just treating it with narcotics. We're using medicine that works on all the different pain receptors, from your skin to your spinal cord to your brain, as well as local and regional blocks. And by doing this, we're able to decrease pain and also decrease narcotic use. If you have to use a lot of pain medicine, a lot of narcotic pain medicine, there's a lot of side effects: confusion, constipation, nausea. And if you have those things, you're not going to be leaving the hospital very soon. So multimodal pain control is a big part of how we get people up and moving quickly. I have programs for my patients to make sure that there isn't any modifiable risk factors for infection or complications after surgery. There are things that we can do to make patients healthier, and I've kind of institutionalized these in my practice. So all patients are screened for MRSA. MRSA is a type of bacteria that can cause very serious infections, and it's in the community. Some people have it on their skin. And if you're a carrier for it, that puts you at very high risk for developing a very serious infection with a hip or knee replacement. So I screen all my patients for this. If you're a carrier, you're going to get treated for it before you come in and have your surgery. Anemia is another one that, if you're anemic, that raises the risk of complications after surgery. So I screen for anemia and treat that. Malnutrition and poorly controlled diabetes are two others. So there's things we can do to tune people up before surgery to make it a safer procedure. Our operative times, our blood transfusion rates, our complication of care ratios, as a result, are amongst the best, not just in Virginia, but in the United States. And that's not just my opinion. We've won several awards. We've been given the Health Grades Joint Replacement Excellence Award the last 2 years. We've been given the Patient Choice Award for customer service from 2012 through currently. We just got the 2017 award. We've been recognized by Anthem Blue Cross and Blue Shield as a Center of Distinction. And Becker's Hospital Review recognized the orthopedic hospital as one of 100 hospitals nationwide with great orthopedic programs.